Inside the debate on Capitol Hill is Republican Congresswoman Diane Black, member of the Budget and Ways and Means Committees. Representative Black, thank you for being here.
Oh, you're welcome. Thank you for having me, Alex.
Let's talk about the possibility of a compromise. Is there one you would be willing to accept that does not affect the health care law?
Well, we have done what the American people wanted us to do. We have heard from the American people they do not want the government closed down. They want us to fund the government, but as well they don't want Obamacare and the harmful effects of that. So we passed a continuing resolution. We also added to that a delay. Now, look, this delay is not terribly unusual because the president has delayed major planks of his own legislation. He delayed the employer mandate. He has delayed the provision of verification. He has also most recently delayed the SHOP, which was the program for the small businesses, and also the limit on the out-of-pocket expenses. So the government, or the president has delayed his own bill, major planks of it. We believe this bill is not ready for prime time. It is harmful to the American people, and we are doing what they asked us to do, and that is to delay it until it can be ready for prime time.
Well, you talk about those delays that the president has implemented. That said, the exchanges, they're ready to go. They're up and running as of Tuesday for people, for the most part. Maybe a few technical glitches, but they can certainly get up and running.
Well, I think there are more than technical glitches. If you take a look at the verification piece, where they do not have the IT system ready to verify people's income, we're setting up the hard-working taxpayer for a lot of fraud and abuse where people just self-attest. We've got navigators who only have 20 hours worth of education on a very complex kind of program. And by the way, they have no background checks, so they're going to get all of our personal information. We saw 2,400 Social Security numbers that were released just last week. Whole process that's not ready to go.
Okay.
It is not ready for prime time.
All right, but now when you talk about the polls you're citing where the American public says they don't want the government to be shut down, they also are citing they don't want there to be government shut down, and they don't want it to shut down over this business with the Affordable Care Act. I mean, there are polls that suggest that as well.
Alex, we're not shutting the government down. The House had a measure last night where we continued to fund the government, but we also did what the people asked us to do, was to delay this bill, which are harmful effects to our economy, loss of jobs.
You are certainly aware, Ms. Black, that the Senate is not going to go along with the bill that you are presenting to them. They have said very clearly they're going to reject it. And even beyond that, were they able to get something that would possibly approve it, which again is entirely unlikely, the president has said he will veto it. So in effect, isn't the House shutting down the government?
No, we're not. We're giving the senators an opportunity to take a look at what we're sending over to them. The medical device tax was something they have already voted for in the delaying the medical device tax. They voted for that in the president's budget or in the Senate's budget. So we've given them some things. Where is what they can give us to ensure the American people that the harmful effects of this bill are not going to take place? Where is that? And so I can't tell what the Senate's going to do. I don't make a guess on what the Senate's going to do. We have to act in the House upon what the American people are telling us. We're seeing jobs being lost, the rising of premiums. We're also seeing that there's limited numbers of choices for people in the health care. You know, the president said, if you like what you have, you can keep it. The American people are waking up to find out that is not at all true.
Now, in terms of
these are promises that were not being kept by the president.
In terms of things that will happen if the government is shut down, there are a number of people who will not be paid, government employees. Now, granted, what you've sent back to the Senate will allow for the military to be paid, which many people applaud, certainly deserve to get IOUs. That said, Congress continues to get paid no matter what. Is that fair?
Well, I don't think we're going to close the government down. We are working very, very hard to keep the government open. And we're here working. On a Saturday night, up until midnight, we're here working. Where are the senators? Where was the president yesterday when we were here working? He was out playing golf. Where's his negotiation? You know, I'm frankly really upset that he's willing to negotiate with Russia and Syria, and Iran's not willing to negotiate with his own congressman.
But don't you think that now, as of yesterday, really the ball was in your court yesterday, so you were doing your work, and the president, I'm certain, was being informed on everything and returned to the White House with further meetings and being informed on what has happened while you were doing your work. But one thing I do want to say the White House did do was release the price plans for the exchanges last week. Tennessee actually has the second lowest rate in the country for the average plan, $235 a month before possible tax credits. What's your take on what we've seen so far from the financial perspective?
Well, I don't know where the numbers are coming from that you're talking about, Alex.
From the White House.
It may be that you're talking about what their estimated cost was going to be, and the difference between the estimated cost and what it actually is was less. But when we take a look at Tennessee, we see rising premiums. So I'd love to get you those numbers so that you can see the actual numbers from our Department of Commerce of how it's going to negatively impact the people of my very own state.
Okay, I'm actually looking at the Tennessee in your paper there in your very own state, and they're the ones that have reported this, multiple articles, so perhaps that's something to be considered. May I also ask, are you advising your constituents without health insurance not to sign up for the exchanges?
Well, I'm not advising them on anything because we still don't have definition about exactly what's going to be happening in the state of Tennessee. I will say our Department of Commerce was very concerned about navigators not having background checks, and they are requiring, and the state does have the authority able to do that, but they're requiring that when people take your Social Security number, your bank information, your health information, that these are people that have been qualified not only in their learning about the system, but also that they have background checks, so they don't have the most personal information that could be let out there and used in ways that we would not like our identity to be used.
Certainly. Representative Black, I must say, you were a nurse before entering politics, for which I have tremendous respect. How does that experience paint your stance on health care?
Look, I'm going to tell you there were things that needed to be fixed, and they are things that have been in this bill that I have talked about openly that are good things, such as making sure that those that are 26 years and younger can stay on their parents' plans if they're still in their parents' household, about pre-existing conditions being covered. These were absolutely things that we needed to look at. But you don't throw the whole system away and tell people, by the way, you can't keep what you like if you have it. You're going to have to do what the government says. That was the wrong direction for us to take. We need to stop, pause, look at what's good, keep what's good, and throw out what's bad, and ensure the American people that we're not going to have harmful effects by this law.
Republican Congresswoman Diane Black, thank you very much for your time with me.
You're very welcome. Thank you, Alex.